Let's talk about a complete versus a partial hysterectomy. This has been a common thing lately in our office. I don't know if there's a TikTok going around or I don't know what it is, but lately there's been a lot of patients saying that I'm having a hysterectomy, but I want to leave my cervix. So why? So let's kind of go over the misconceptions about that. So a total hysterectomy is removing the cervix and the uterus. The partial hysterectomy is leaving the cervix and just removing the uterus. So if you're having a vaginal hysterectomy, it's not possible anyway to leave your cervix, and it's really not done anymore. It's also called a supracervical hysterectomy, so it's everything above the cervix that's being taken. So a lot of the common misconception is, well, if I take my cervix, I read online that I'm not going to have any sex drive. I'm not going to enjoy sex anymore. Well, it's not true. So I can tell you that a lot of studies show that actually the sex drive will increase and your desire and libido will increase after having a hysterectomy, because for most reasons you're having it done because you're having issues or bleeding or fibroids or something, pain. And by removing the uterus, then all of those symptoms go away. So now you enjoy sex again and want to have intercourse again. So leaving the cervix behind, so what benefit is that? Nothing. And I can tell you the bad things that it will, the risks that are associated with it. So some of the risks are, number one, bleeding, because you can have bleeding from your cervix. Number two is you still have to have the pap smears, the cervical cancer screening, because you're still at risk for developing cervical cancer. So by leaving the cervix behind when you had your uterus removed for a benign reason, now you're at risk for developing cervical cancer. And the third thing is now you have to go through another surgery if something does happen. So now you went through this, big surgery to have your uterus removed, and now you just have to go through a whole other surgery to have your cervix removed. So overall, there's really no reason to leave your cervix. There's no reason to whatsoever. And all of these things you're reading online about it decreasing your sexual desire, you're not going to enjoy intercourse anymore, you're not going to want to have intercourse anymore, it's just not true. So talk to your provider today, clarify your concerns. They will educate you, provide you with all the information that you need to make the best decision for yourself. And if you're local in the area, just give us a call. We'd love to talk to you.